For many studies, one of the most important things that we collect is the biological samples. So these are things like blood, tissue, and saliva. What people don't see is the careful behind-the-scenes work that goes on in laboratories, just like this one, in looking after the biological samples. My name's Kendra, and I'm the Translational Support Manager. So I manage the TSU, which is the Translational Support Unit, and we're a team within OCTO, which is the Oncology Clinical Trials Office here at the University of Oxford. And it's our job here at the TSU to make sure that every sample collected is handled safely, accurately, and responsibly. You can think of us as guardians of a scientific library, where every book, or in this case, biological sample, is collected, preserved, and catalogued so its story can be read and its information can be trusted when it's needed most. When a sample arrives with us, the process begins immediately. First, we make sure that it's labeled correctly so that we can always trace it back to the right clinical trial and to the right visit. And we always make sure that there are no personal identifiers on the sample, so you can always be sure that the samples we receive in the laboratory are anonymized. We then proceed to process the sample, and this is following very strict scientific and legal standards. Every step is carefully timed and recorded because even the smallest differences could impact the scientific value of the sample. Ultimately, this is what helps us to make better decisions about new treatments. Clinical trials can generate a lot of waste. We try to minimize that by reducing waste, optimizing freezer temperatures, or recycling where we can. Every sample represents a person's trust, and so we believe we should honor that by using every resource responsibly. For everyone here at the TSU, this work is highly meaningful. The task might look small, a correctly printed label, a freezer check, correct processing, but together they can help transform a participant's sample into knowledge that could change the future of cancer care. So when you take part in a clinical trial, know that your samples are not only safe, but are truly valued. They are handled with care, precision, and respect every step of the way. Thank you.